Welcome to Aetna Medicare Advantage. We measure our lives by the connections we make. That is why we take a total and connected approach to health. An approach that uses technology and data to help you manage your healthcare experience as you work with your doctors, pharmacists, and others involved on your path to better health. At Aetna Medicare, we put care all around you, connecting you right where you live to the hospitals and physicians you know and trust, connecting you in person to resources like transportation to doctor appointments, connecting you over the phone with care management or our 24-hour nurse hotline, connecting you online with telehealth and Silver Sneakers fitness memberships with virtual access. Our plans also include extra benefits like the Resources for Living program, dental, vision and hearing coverage, an over-the-counter product allowance, and so much more. We want to introduce you to some important information you need to know when considering a Medicare Advantage plan or DSNP. We'll be providing information about a specific type of plan, but be sure to talk with your local representative to see which plan is the right fit for you. Let's begin with understanding Medicare. Medicare can be complicated. Let's simplify it by learning about the 4 parts of Medicare: A, B, C, and D. Government programs, or Original Medicare, include Part A and Part B. Part A, your hospital care, covers things like inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. Part B is your medical care and may require a premium. It covers services from doctors and other healthcare providers, outpatient and home health care, durable medical equipment, and even some preventive services. Part C are private medical plans, sometimes referred to as Medicare Advantage, and are run by private insurance companies. These include Part A and Part B benefits and services as well. Some Part C plans include Medicare Part D, which is for prescription drug coverage. Enrolling in Part D gives you access to some extra benefits and services, like full or partial coverage for the cost of prescription drugs, and may help protect against higher costs in the future. Now let's learn about Medicare Advantage and Dual Eligible Special Needs Plans, or DSNPs. Medicare Advantage is a lot like Original Medicare, but with many more benefits. Medicare Advantage plans typically cover things that Original Medicare, Parts A and B, doesn't, like dental, hearing, vision, and fitness memberships. Many insurance companies also combine prescription drug coverage, Medicare Part D, and medical coverage in their plans. A Medicare Advantage DSNP is available to beneficiaries who have both Medicare and Medicaid and live in our plan's service area. For a partial benefit dual eligible, you do not need to meet state Medicaid eligibility requirements, but you do need to meet the Medicare Savings Program, or MSP, requirements. We'll take a closer look at MSP in a moment. For a full benefit dual eligible, you must meet the state Medicaid eligibility requirements. For both benefits, you must meet the citizenship and residency requirement. Do you have both Medicare and Medicaid? If so, you could qualify for a DSNP. DSNPs are specialized Medicare Advantage plans created for those who qualify for both Medicare and Medicaid. With a DSNP, you could get extra benefits that go beyond Original Medicare, like a personal care team that can help you build a care plan, understand your medicine, set up doctor appointments, and more. With a DSNP, you could also get extra benefits, such as more transportation, dental care coverage, vision benefits, prescription drug coverage, hearing benefits, more over-the-counter products, and a large network of doctors, hospitals, and pharmacies. Let's learn about Medicare Part D. We want to welcome you to an incredible pharmacy network. With over 65,000 pharmacies in our network, filling your prescriptions is convenient. And more than 23,500 offer preferred cost sharing to give you the lowest price possible for your drugs. Finding a network pharmacy near you is simple with our online network directory at aetnamedicare.com. There are a few important terms to know so that you can understand your prescription drug benefits. A formulary is a list of drugs covered by your plan. A tier is a group of drugs on a formulary. Each group or tier requires a different level of payment. You might see the groups listed as generic drugs, brand name drugs, or preferred brand name drugs. Higher tiers usually have higher cost sharing. For example, a drug on Tier 2 generally will cost more than a drug on Tier 1. Your network is made up by the pharmacy options you have for getting your prescription drug. You may get a one-time fill of a drug that isn't covered on the formulary. This is known as the transition process. Remember these important formulary tips. It's important to be familiar with our formulary and check it before filing a new prescription. You can view our formularies at aetnamedicare.com. Keep in mind, sometimes formularies can change. So for the latest information, just visit our website or simply call us 24/7 at 1-855-338-7027, TTY 711 to get help with the formulary. There are a few more things you may need to know. Your plan may also have drug coverage rules. For example, some drugs require prior authorization. This means your doctor must first show a medical need for you to use the drug before the plan will cover it. Quantity limits place a limit on how much of a drug you can get at one time. With step therapy, you must first try another drug on the plan's formulary first before you can move up a step to a higher tier drug. To get more information about the drug coverage rules for your specific plan, just view your formulary at aetnamedicare.com. You may qualify for help with your Medicare drug costs if you have limited income and resources. Extra Help is a Medicare program that helps pay some Medicare prescription drug costs, such as your monthly plan premiums, yearly deductible, coinsurance, copays, and coverage gap. To see if you qualify for Extra Help, you can call 1-800-MEDICARE 24 hours a day, 7 days a week. Call or visit your Social Security office or state Medicaid office, or just visit Medicare.gov. We can also check to see if you qualify for special programs that help you pay for your medicine, health care, housing, and utilities. Talk to your broker or give us a call to see if you qualify for a plan with extra benefits at low or no extra cost to you. You can also visit aetna.benefitscheckup.org to see if there's more help you may be missing. Benefits Checkup quickly finds federal, state, and private benefit programs you may be eligible for. These programs could help you save money on prescription drugs, utilities, taxes, meals, and more. Now that you understand Medicare and D-SNPs, it's time to sign up. Generally speaking, you can only enroll in a D-SNP during specific times of the year. If you're newly eligible for a D-SNP, you can enroll at any time of the year with no restrictions. If you already have Medicare and Medicaid, or you're already enrolled in a D-SNP, you can switch plans once during each of the 3 special enrollment periods, or you can enroll during the annual enrollment period. Be sure to talk with your local agent to see when you're able to enroll. You have the option to download an enrollment kit. Inside you should find an Informed Choices section that explains everything you need to know before choosing your plan, a Back to Basics section that explains the basics of Medicare, a Closer Look section with your plan's summary of benefits. You can use this summary to get a general understanding of your coverage and responsibilities. It explains in general terms what Aetna covers and what you'll have to pay for. Keep in mind, the summary of benefits doesn't list every service or every exclusion. For specific information, you should refer to the plan's evidence of coverage. You can learn about Medicare star ratings in the star ratings section. Finally, a Rock Enrollment section to help you get started with your enrollment. Medicare star ratings let you know about a plan's quality. Each year, Medicare rates all health and prescription drug plans based on a 5-star quality rating system. The Centers for Medicare and Medicaid Services, CMS, rates plans on a scale of 1 to 5 stars, with 5 stars being the highest quality. They use information from member satisfaction surveys, health plans, and healthcare providers to give overall performance star ratings to plans. CMS star ratings can help you compare plans based on quality and performance. To find the star ratings for Aetna plans available in your area, just visit aetnamedicare.com. Once you're a plan member, you'll get your member ID card to use with your Medicaid card, along with occasional letters or phone calls from us and our partners. On the front of your member ID card, you'll see your plan and ID numbers, which you'll need to give to your doctor. On the bottom left is the contact information for your primary care physician, or PCP. On the bottom right is your contract PBP number, which you'll need whenever you use our online tools. And on the back of your card, you'll find important numbers for customer service and the 24/7 nurse line. Now that you know more about your different Medicare plan options, it's time to get more information about the specific plans available to you. Aetna has the resources you need to help answer your questions. At Aetna, we're bringing care right to you because that's how you make healthier easier. We're putting you at the center of your care, creating a seamless health experience that takes care of the whole you, body, mind, and spirit, so that each and every day you get the answers, the support, the care you need when you need it. Because when a health plan really shows up, when it is there for you every minute of every day, you begin to feel truly cared for. And that results in confidence, the confidence to age actively, to greet each day with more energy, more optimism, to start thinking less about how to stay healthy and more about the life you love. We measure our lives by the connections we make. Aetna Medicare Advantage.